Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Disruptive Physician Labeling, a Symptom of Systemic Burnout. Jessie, welcome back to the show.
Nice to be here.
All right. What's your latest article about?
So, this article is about this phenomenon that I am just seeing more and more and more of, and it makes me upset. So, this physicians being labeled as disruptive or poor communicators or bringing the wrong energy when most of the time, and I will say not all of the time, but most of the time, these physicians are those who care tremendously and are exceptional physicians who are sort of bearing the weight of the system and trying to make change. And so they'll be labeled as disruptive when really they're challenging the norms or they're saying this is a problem or that is a problem. And wanting to bring up that conversation and also normalize it. And in particular, lessening that shame around it, because a lot of people who reach out feel like it's a them problem and what have they done, and that maybe they've failed. And so to empower people who potentially listen, that like, if this happens to you, doesn't mean you're a bad
Mhm.
doctor, and there are things that can help. And it's often an opportunity to advocate for yourself. I think one of the things that coaching helps with is to help you become a better advocate for what the problems that you see. And so not just being a problem spotter, but being really strategic in how you bring these things up and working on making your own situation healthier so that you can show up in a way that works for the system and for you, but without, giving up who you are and what you believe in the process.
What are some specific examples you've heard of things physicians have done that had them being labeled as disruptive?
Well, they will often bring up problems with the system or unsafe patient situations or complaints or things that need to be fixed. And I think to be fair, and I am never in the moment where they actually said the thing, but I'm sure that the thing that they brought up could have been said more eloquently. Because I think when we're completely depleted, we're never particularly elegant. And when we're reactive, we tend to have a shorter temper. That's expected in a system where we're pushed beyond our limits. But these are things where physicians really feel like they're in a situation of moral injury or that patients aren't getting quality care in particular. And it may be that they, of course, usually could have handled it in a different way or been
Mm.
more strategic, or maybe they will bring up things to the wrong people or in the wrong language, and sometimes things are brought up in ways that actually are problematic, like maybe in the chart or maybe in a with nursing, or and so that it can create more problems rather than solve the problem. And usually the points that they're making are really important. And so it's coming to a head, I think, because the pressure is so heavy in medicine, and people who practice in medicine want good care and they want to do the right thing and they want the systems to work. We're, after all, trained as problem spotters, right?
Yeah.
And yet, very often, those people we're pointing the problems out to are not actually interested in us spotting the problems, or they don't see it as our job, or maybe there is no clear solution. But what's happening is these physicians are then being put in a spot where they maybe have to defend their actions and or do something in remediation,
Mhm.
or and I think that there is learning here. No one ever taught us as physicians how to advocate effectively. And, when I went to med school, the system was completely different. So none of this was an issue. We weren't working in big business. And yet it's sort of a conflict between our inherent beliefs and a reaction to moral injury.
So, how much of it do you think is that lack of eloquence, like you said? Because a lot of physicians, we're not trained in being as diplomatic as we should
Yeah.
be. We're not trained in politics, right? And a lot of the administrators, they come from a business background where they have that formal training in negotiation. How much of it is really just a lack of polish on the part of physicians?
Well, that's an interesting question. A lot of it is a lack of polish. A lot of it is that, we didn't learn. A huge piece of it also is just depletion and the pressure and the when we are not resourced internally, we don't show up as our best selves. So if we're post-call, we're very likely not to advocate. So no matter how well we've been trained, that's not our best moment in time, for example. And then so I think that a big piece of that is that we can learn and make it better. I find that through coaching, it makes a big difference.
Mhm.
Recognize pretty quickly that, well, what initially felt like a personal attack is like, oh, I could be doing this better, and I do care. When you honor that physicians really care, and this comes from a place of wanting to provide exceptional patient care, and nobody wants to not be a good colleague or not be a team player. I mean, there are occasional people, but 99% of physicians are here for good reasons.
Mhm.
That then there's relief in knowing that this is a learnable skill and that they can work on those things without just saying the system is fine, because it's not, right? And so it's how to be eloquent. It's not all that, but I think there's a huge learnable piece of this.
Now, if a physician has been labeled disruptive, what are some of the ramifications of that?
Well, they can be really significant. I think that often what I see is they're being asked to do something in response. And so people come to me for coaching in response, which I think they're really looking for something that helps with communication or something that helps with reactivity. So mindfulness and, specific sort of professional development coaching is a solution for that. But oftentimes, people I'm lose jobs over it,
Mhm.
and people end up on, we call it, it's just not a nice word, performance improvement plan. And I heard at a conference once someone speak to this idea of what if it was like a professional investment plan, and that we were investing in our physicians to be able to make change in a way that works for these complex systems that we aren't necessarily trained to advocate in. I also see for many people, these are people who want to be leaders or who are leader types but don't have a leadership role, and so
Mhm.
they're just sort of advocating and asking, which may be seen as out of turn. But I think the ramifications can be huge. The ramification I worry most about is the shame, blame, guilt, feeling like they've failed, and also feeling really like they're hopeless and helpless because the efforts are usually on behalf of making the system better. And so if they can, then they're like, well, if I can't make the system better and I'm getting in trouble, like, what's the whole point? And so to me, that's the highest stakes when people give up or hide because they feel bad. And I think that what I really hope listeners hear here is that it's not just a you problem, and there are things you can do, but it's what I would say is a natural reaction to working in really difficult
Mhm.
situation where a lot of things don't make sense. And if you point out that it doesn't make sense, that puts other people on edge. The other thing I think is really important is this idea of nervous system co-regulation. So we're bringing stressed out nervous systems as people who work in the system, but everybody else is too, right? Patients are the nursing staff is, the hospital staff is, our colleagues are, and even the administrators in healthcare today are also feeling incredible stress.
Mhm.
And so it's not just what we're bringing, it's in reaction to what other people are bringing. And that's where I think the work on how we show up and the emotional sort of intelligence that we can bring to it and specific advocacy strategies is really, really helpful, rather than just walking into the perfect storm
Yeah.
without a raincoat.
And you wrote in your article that a lot of times these institutions treat systemic dysfunction, and instead of addressing it, they blame that individual physician, right?
Yeah, yeah. And that feels terrible. And I think that then that's where the hopelessness and just extreme frustration comes. And when we are hopeless and frustrated, we don't actually communicate even better,
Yeah.
right? It creates
Yeah.
a spiral of frustration. And what I see is most of these people desperately want to stay in medicine,
Mhm.
actually love patient care, love their jobs, feel a tremendous sense of purpose or mission driven. And I think it's really hard to be mission driven in a system such as we have today. I mean, in some sense, I do want to say everybody's mission
Yeah.
driven, but the functionality of it is such a quagmire, and I just use the word broken right now, that it makes it a little bit like stepping on landmines right and left.
So a lot of these times they are instigated by a physician seeing a patient care issue. Sometimes it's a
Mhm.
whistleblower
Yeah.
situation. So, what kind of advice do you have for these physicians who do want to bring it up, but
Yeah.
don't want to risk being labeled as disruptive?
Well, I would say one, don't do it when you're tired or
Okay.
post call or in the moment, right? Be thoughtful, be intentional. And I think when we come at it not from a place of blame, but from a place of suggestion, right? When we call people out and imply that they're doing harm, for example, we come at from an injustice point, and that's not usually our most effective advocacy strategy. So really thinking about how might you motivate people or inspire people, thinking outside the box. And I think thinking long term, we bring our urgency to it. This has to be fixed today. And could we really look at it long term and say, well, this is something that we as a system could work on? These are some ideas out of the box that I have, rather than the sort of blame,
Mhm.
anger, frustration, which could 100% be warranted, but they're not a strategy to having change. And I do think that getting some kind of, communication or leadership development training or business training, you want to understand, you want to put yourself on the same playing field. And I think that sometimes when we're like the physician on the ground, we think that's not our job. In fact, we were told it's not our job. But in medicine today, it really is our job. And I think that thinking about how can I be strategic? Who is the person to bring this up with? Where is the most effective place? Where are the cracks where things could change could happen, rather than just lashing out or saying
Mhm.
what you think, and to set yourself up for success. So to really, and that is not just pausing, but bringing it up when your nervous system is regulated, bringing it up when you have energy, bringing it up in a thoughtful way about who should you be talking to, what do you want to bring up. I also find the big, I'll say, preventive care measure is to decide really specifically what your intention in being at work is, so that you can have these thoughts afterwards. And usually our intention is to provide exceptional care and connect with people and find, purpose and passion and meaning in our work. And so if we can focus on that in the moment, it doesn't mean that you ignore all this. It
Mhm.
just means that you are advocating from that energy. The other energy that's super effective is to think how these people you're advocating about this to want the same thing as you,
Mhm.
right? They want to save money. They don't want, these things, but being strategic in it rather than convincing or showing up with anger, because it's not usually our best convincing strategy.
And I know we've talked about this many, many times in our past conversations, that importance of the pause, right? And
Yeah.
not acting out from a place of judgment or not acting out from a place of
Right.
emotion, having that pause. So, like you said, you can act and respond strategically.
Yeah. And I think if you have been called out, this comes up a lot. Sometimes we have to lay low for a bit or grow a different reputation before you, because you can't just continue. Once people have decided that you're the one who's always bringing things up, they tend to not listen. And
Right.
so it's also being thoughtful about your strategy and the timing. I love this word, being strategic, right?
Yeah.
And then I would say for institutions, they can also make a difference by, rather than, reprimanding or being punitive about it, how can they support physicians to get training and have systems for advocacy, et cetera? Because I think this makes work for everybody, honestly, and
Mhm.
nobody really needs any extra work. And so, how can we set up systems whereby we help physicians learn to advocate effectively? I think in many ways we're set up in an adversarial setup
Mhm.
right now. And so that's not helping any of us.
Sure.
And I have seen many institutions very clearly want to help their physicians. Nobody wants to lose a physician, right? So when it comes to this, they are really looking at how can we support physicians, what will work, and letting people think outside the box about what will work. And so far, I think that everyone benefits from that. I mean, not so far. I think everyone will ultimately benefit from that. But I see it in action. And so I don't think that, organizations, I think we just have these systems and it's like someone complains, so we have to respond in a certain way.
Yeah.
But could we really look at it as a sign of needing support or a sign of burnout, rather than a sign of, I would say it's not a professionalism issue. It's a sign of needing support.
Once a physician is labeled as disruptive, and you alluded to this earlier, can they recover from that? Have you seen instances where they've recovered from that disruptive label?
I think so. I think it takes a very conscious intention and often a bit of sort of, well, I'll say a pause, right? A step back and to be clearly showing up in a different way and beginning to lead. I often talk about leading as a lighthouse rather than like being a rescue boat.
Hmm. Hmm.
And so if you can start to, for example, not being the one that always speaks up in the meeting, but being the one who says something strategic or pointing out where you agree and where things are working, you can. It takes, of course, more time than any of us would want. And I think some people change settings because they've been labeled as that. But if you don't work on yourself in between, you end up kind of labeled as that
Hmm.
wherever you go. I do think people can respond from it. And in fact, it can be a pivotal moment where people recognize that actually this person is a leader, and with some leadership support could actually be really helpful. And you might be even more effective in that role if an organization has the space and capacity. I think it depends on where you work, right?
Yeah.
A more functional place would be open to this. I have seen people be able to get back to loving their work and not feeling like they have to hide in the corner, but it takes work on all sides.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Disruptive Physician Labeling, a Symptom of Systemic Burnout. Jessie, as always, let's end with take home messages they want to leave with the Kevin MD audience.
I would say two. One is for the physicians to recognize that this isn't a failure or a broken you and nothing to feel ashamed about, though that will be your natural response. How can you use it as a way to advocate for yourself and getting extra training and making sure that you refill your own cup and learn how to advocate in an effective way? It can be a great career opportunity. And I think for the institutions, could we move away from this labeling? And could we instead recognize that often these instances are, calls for help or a need for support or a need for training? And I mean, ultimately, maybe we could put that before these instances happen, but at least at this point, could we look at things a little bit differently? That being said, sometimes I think the labeling is what's required to get the financial support. Sometimes people will get financial support to get help or to help people recognize it as something that needs to be done. And so there's going to be a spot in between. But can we really work collaboratively, given that I do think ultimately all of our goals are aligned, which are to have physicians continuing in medicine, enjoying it, and all working together on a system that works better.
Jessie, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure.